As I mentioned, kind enough to join us this morning, Dr. Derek Eddy. Dr. Eddy with Sports Medicine Center Shockwave treatment. What is this all about? We'll let Dr. Eddy take it from there. Derek, thanks for joining us on the show this morning. Talk about shockwave treatment.
Yeah, Ray, thanks for having me. Shockwave treatment is something that's really becoming a lot more accepted and popular in the United States, as they've been using it in Europe for quite a while. It's something I've been doing for the past year, and I've seen great results with it for people that are struggling getting better. So a lot of people, when they hear shockwave, they think like electricity kind of shock, and it's not that at all. It is sound waves, and there's actually two different types. There's what's called radial pressure wave, and that is a type that I'm using for, like, can treat broad areas, like muscle and the tendons close to the skin. It's more of a superficial treatment. And then I have focus shockwave, which is more kind of again, it's not light, or it's sound waves, but you think of it more like a laser beam, very precise, so I can put into tendons, and I can control the depth with it, so I can get down deeper, up to like 6 centimeters into the body. So treats a whole host of things. Again, so what it does with those shock waves, it's stimulating your body's own healing response. So a lot of people kind of get stuck, say, like with a tendon, like a rotator cuff or a tennis elbow, or that's been studied a lot with this is plantar fascia. So if you have a plantar fasciitis and it's just it's not getting better, kind of stuck in this chronic phase, these sound waves go down into the tendon, stimulate. You turn on your own healing process and kind of turn the chronic phase into an acute phase and get some healing going.
With us is Dr. Derek Eddy with us, Sports Medicine Center Shockwave Treatment. Derek, let me ask you this. You mentioned get into tendons and I imagine ligaments. I imagine also muscles, and can you even take it to the bones themselves? Is there additional treatment there? So muscle tears, so bones. There's been a lot of studies showing fractures that aren't healing. You can use shockwave to kind of stimulate the bone to heal. Dr. Derek Eddy with us from Sports Medicine Center. So this is radio, so it's audio, so sometimes it's difficult to put the pictures together. But kind of describe us as best as you can when we go for a, quote, shockwave treatment. What's happening inside the room for us?
Yeah, so I mentioned there are two different types. So there's these handheld pieces, attached to a machine. Mm-hmm. So I'm putting this piece on your body. I have to use coupling gel to propagate the sound waves from the handheld piece into the body. So we use a little ultrasound gel that puts the sound waves into it. So they look like phasers from Star Trek, and it's pretty kind of like Star Trek-esque, right? It's very futuristic. These treatments. Lasts anywhere from 20 to 30 minutes, kind of depending on how big of an area that I'm treating. And it does take 3 to 6 treatments on average. Now, I've had some that, 1 or 2 treatments and people were much better and they were good. But on average, 3 to 6 treatments.
Derek, let me ask you this. If we go in and we're having, let's say, a sore knee, and let's say you get a cortisone shot. That cortisone shot will last you, they'll say sometimes 3 to 4 months, depending on patient to patient. When we get this shockwave treatment, what's the longevity of the shockwave treatment? You mentioned depending on the patient, the severity, it could be 3 or 4 visits, but what's the lifeline of the shockwave treatment?
Yeah, well, so it's going in there. So steroid is kind of we're not sure why a lot of it works with steroid. Is kind of it takes out inflammation and pain, but really it doesn't really induce healing. So this is actually taking damaged tissue and turning it into healthier tissue. So hopefully you're good, right? Now, some of these things that you can kind of undo with, like these tendon, right? You go back out and, keep using it. And so kind of wear and tear, that's what a lot of times what we're treating. So, there's a potential of it coming back, but for the most part, we're actually trying to get the actual tissue to be normal tissue. The nice thing, too, is there's no downtime. It's it's non-invasive. There's no risk for infection or anything like that, and it works about 80% of the time for people that have again failed usually therapy or injections and that kind of stuff too.
Dr. Derek Eddy with us, Sports Medicine Center. Is this similar to some degree of the procedure that's now cupping, or are they completely different?
Yeah, completely different. Completely different. That is using, like a suction vacuum kind of deal on the tissue. Again, these are sound. We're putting energy into the body to get the healing, and I think has a lot more data backing it up.
How do you, Derek? How do you qualify for a shockwave treatment? Do I just walk in and say, "Hey, I want to do a shockwave treatment," or certainly your doctor would probably recommend it? How does that work on that end? Yeah.
I mean, so people are sent to me all the time, and so typically the first visit is we're talking about if you're a good candidate or not. The good thing is actually, again, because of it's non-invasive, I've been on the show before talking about PRP, and so that's just a different way to induce the body's healing response, but that is a little bit more invasive, right? You're using a needle. For the most part, most people, whatever condition, with musculoskeletal, you're probably a good candidate.
It sounds terrific. It sounds like it's a win-win for sure. I love the technology and the idea of putting these waves in and taking the body. I just love the idea. It's interesting. Now that you've kind of introduced me to it, I'm going to do some reading on it for sure to get some additional information. It's fascinating. Derek, thanks for joining. Anything else you'd like to relate to the listeners that maybe I jumped in and asked you some questions that you wanted to get out for the listeners? Anything we missed?
So the only downside for this is the insurances. Like the PRP, I think we talked about before. These newer technologies and things like that, the insurances don't like to pay for it. So that is the bummer. That is the downside.
Yeah, that is a downside for sure. Derek, thank you for joining us, and really the education, Shockwave treatment, folks. Maybe look into that, Coach. I should say, Dr. Eddy, thanks for joining us. We appreciate it.
Yeah, thank you for having me.
Of
course.
Have a
great day.
Yeah, you too.
Bye-bye.
Dr. Derek Eddy joining us, Sports Medicine Center, joining us this morning. Really good information. Shockwave treatment